Hello, everyone. My name is Sheila, and I'm the Allied Health Engagement Officer at CHN. Thank you for taking the time to attend today's briefing session on the Multidisciplinary Approach to Diabetes, or the MADC pilot program. We'll start with a presentation about the program. There'll be an opportunity to ask questions via chat afterwards. Now, this session is recorded. It will be available to all the attendees and on the corresponding tenders page. Now, I'd like to request that all participants please place yourselves on mute during the presentation. Now, before we begin, we'd like to acknowledge the Ngunnawal people as traditional custodians of the land on which we meet today, and we pay our respects to elders past, present, and emerging. We also extend that respect to the elders of the land that you are joining us from today and any First Nations people who are present. So what is this tender opportunity about? As part of strengthening Medicare measures, the PHN, or Capital Health Network, received funding from the Australian Department of Health and Aged Care to commission a multidisciplinary team from allied health professionals, nurse practitioners, nurses, midwives, or Aboriginal health workers or practitioners. Now, this is meant to support small or solo general practices, including the ACCHS, to improve the health of underserved patients. Now, the objectives of the grant opportunity are to design an approach for multidisciplinary services in the ACT through consultation with small or solo general practices, or the ACCHS, that are unable to engage a multidisciplinary team through other funding streams. To identify priority areas of need in underserved or financially disadvantaged communities, to commission a multidisciplinary team with a focus on supporting smaller practices that do not have the size or scale to engage the full range of health professionals required to provide effective MDT care, to extend the PHN's existing role in general practice to support private allied health, nursing, etc., and establish reporting processes supported by data collection and data management practices, including activity and outcome measures, and to monitor implementation of the activity, utilizing relevant outcome measures and developing adjustments to the approach if required. Now, why diabetes? Looking at the CHN needs assessment in 2021 to 2024 and data from the ABS in the same year, it shows that there is a need to support diabetes in the ACT, considering the prevalence and the reported mortality rate. So in that year, the prevalence in the ACT was 33.9%, the highest in the country, compared at national level of 23.8%. Now, what is this program about? So the proposed project aims to provide free access to a multidisciplinary care team for adults at risk of developing complications associated with diabetes through their local general practice or ACCHS in the ACT. What activities are included? So in scope, we are providing the free services or free allied health services to adults diagnosed with diabetes who are motivated to participate and engage with the program, and to whom multidisciplinary team care would be beneficial. Things that are out of scope would be children with diabetes, gestational diabetes, existing health or medical programs that are already in place through ACT Health Diabetes Services. We will also not be funding social support or recreational activity or activities provided by other providers in the territory. And we will also not be funding for disability support services that are covered under NDIS. And in terms of the commissioned multidisciplinary care, the main stakeholders in the program are the small or solo general practice and the ACCHS, of which there will be general practitioners or the GPs involved, and a practice nurse involvement as well. What does that look like on the ground? So the general practice or the ACCHS will refer or select eligible patients through their practice data, through selection tools, and they will be triaging these patients to see if they would be, benefit from receiving the free allied health services for their diabetes management. And in terms of the team that CHN will be commissioning, it will be made up of an accredited practicing dietitian, a podiatrist, and an exercise physiologist or physiotherapist. And this team will be servicing the general practices or ACCHS that are selected. So it's one team servicing all of the practices. We will also be working with a diabetes educator, but this is not a part of the EOI for allied health. Now, in terms of the program, it's designed to support individuals with diabetes with a focus on patient self-management and health literacy, improved access to services, and multidisciplinary integration and cultural change management in primary care. So the long-term outcomes aim to reduce diabetic complications and unnecessary hospitalizations, as well as improve patient psychosocial well-being. Now, we hope that the program would have clear entry and exit points, and each practice will involve case coordination that's shared between the practices and allied health providers to assess the individual patient needs and also to adjust the supports that are required accordingly. Now, this approach allows for flexibility and ensures that patients receive the appropriate level of support based on their needs and progress. Now, a model, so we've got a baseline model that we've developed over the last few months, and we will be proposing this or presenting this rather to the selected providers at co-design, and together we'll work on that model to see how we can best implement it and what that looks like. So at baseline level, so we've got here on this diagram, we've got the practices, selecting the patients, and in terms of referring them to the program, there'll be that triaging to see if the patients are eligible. We've got selection tools that we can recommend if practices need that. Other things that would be part of this program would be HbA1c monitoring at practice level, the involvement of a practice nurse, there'll be an involvement of a diabetes educator, and CHN will be commissioning the podiatrist, dietitian, and an allied health professional who would be in charge of the exercise intervention. So that could be an exercise physiologist or physiotherapist, and we will be utilizing group MBS items. Now, in terms of the co-design, as I said, this is all up for discussion. So this is what we feel that it would look like. But in terms of the intricacies or how that service is going to be delivered, there'll be a baseline model where there'll be initial and follow-up appointments. But in terms of how many these are, because of personalized care, we don't want to be too prescriptive, and that's something that we would like to discuss with the GPs and the practice nurses and the providers, and determining exactly what that would look like based on the funding that we have. Now, in terms of where the program will be located, the idea is that there will be a diabetes clinic day at the general practice or ACCHS. The commissioned allied health team will deliver the services during diabetes clinic days, and things to consider include the physical space at the practice. And as an example, an accredited practicing dietitian could potentially be co-located at the practice on specific days, but considering equipment is needed for podiatry and exercise interventions, this could potentially be located at an allied health practice or for exercise at a gym or community center. Now, these final details will be determined during co-design review with practices and the allied health providers. And here are some things that we will discuss during the co-design review. So as I said earlier, we've got a baseline model of care that CHN has developed through stakeholder consultation, and we will be presenting these ideas to the selected providers during the co-design to ensure that the model that is implemented works for everyone. And some of the key requirements that you'll find in the service agreements, service delivery, which would include the appointments and the care coordination between among the multidisciplinary team. Program meetings, which involves co-design reviews, program meetings, team meetings, stakeholder meetings, evaluation meetings of the sort. We've got training attendance as required. So that would depend on what is needed by the selected providers. If we need trainings for care coordination, we're happy to look into that and fund for that. If training for PROMs and PREMs is required, then we would also fund that. Cultural safety is one of the big things that we would also be definitely be funding for. Now, in the next parts here. So we've got the enrollment and triage of patients. So that's done at practice level, and care coordination between the practice nurse and allied health practitioners. And there'll be communication with patients, including consent to participate in PROMs and PREMs, and there'll be evaluation activities or participation in surveys. What are these surveys about? The surveys could be about the implementation of the program and what that looks like, how the providers, feel about the implementation, how it's going. So it could be things that would help us to shape the program as time goes by, so that we can have a working model that works best for the MDT, but is also replicable in other chronic conditions. Now, just going back to the previous line, in terms of communicating the PROMs and PREMs, or the consent to participate with patients, why do we need this? So the PROMs and PREMs are there. First of all, it's part of the funding requirements, but also it's important for the patients to understand that as part of their program participation, we will need to measure their outcomes. So at baseline or at the start of the program, towards the middle and towards the end, to see how they are tracking and how the program is actually delivering the outcomes that we set on. Now, in terms of reporting, templates will be provided by CHN for practice performance and financial acquittals. This is usually submitted every 6 months, and monthly invoicing, that will be for providers, and there's a separate discussion for that, but please feel free to send us an email if you would like to have a deeper discussion about this. Now, stakeholders, who are the main stakeholders? So the funders, we've got the Department of Health and Aged Care, we've got Capital Health Network, the Allied Health Professions Australia, or APA, we've got general practices in the ACCHS, allied health providers and the patients. We've got the ACT Chief Allied Health Office, the peak bodies per disciplines involved in the program, Canberra Health Services, their diabetes services and community care in particular. And we also hope to work with the allied health student clinics in the ACT and the Healthcare Consumers Association. Now, dates to remember. So the EOI closes in 14, so that's the 11 days from now. So it's the 24th of February, and that will be at 5 p.m. Now, the review of EOI submissions happens quite quickly after that, and we expect to notify the applicants of the outcome by the 6th of March. By then, if you are successful in your application, you will be invited to submit your proposal, or CHN will be requesting for your proposal. So the RFP opens on the same date, and RFP closes on the 24th of March. Now, we will be reviewing the RFP submissions pretty soon after that as well. And we expect that the contracts will be signed towards late April, and we will immediately start onboarding providers by then. Services will be expected to commence towards the end of May. But again, so the dates are quite flexible depending on what's decided, and after we've got the selected providers, so this is all up for discussion. But the project closes, as of now, the date that we have is the 30th of June 2027. Next steps after the EOI, if you are notified by email and invited to submit a request for proposal, please, as some tips, please keep your answers concise and within the word count. Attachments are not accepted unless specified in the question. Ask any questions via email to tenders@chnact.org.au. Although I am the main contact for this program as the project manager, please send any program or app tender related questions to this email address rather than my work email address. And please take note of the submission deadline. And that's it. So thank you very much for attending our briefing session and listening to this presentation. And once again, my name is Sheila Brito. I'm the Allied Health Engagement Officer at CHN. Thank you very much.